Hi, this is Rajveer from I4 Mentors Foundation. We are a not-for-profit accelerated by alumni of IIT Delhi and I'm Bangalore. Happy to share conversations with some of our mentors and cohort leaders. We are starting a cohort soon. Look forward to seeing you there soon.
Hey, hi Rahul. Very good afternoon. Thanks for joining this session. Really appreciate that. So we'll get started by introducing you to the audience. So if you could talk about yourself a little bit, about your experience, how you got into healthcare sector, and your own experience of innovation in J&J, that in the diabetes space, how you actually came up with a wonderful product, and anything else that you would like to talk about.
Okay. Thank you, Rajpreet. I think it's been wonderful being associated on this journey where we are helping startups. And I think thanks to IIM Bangalore, which felt the need to connect with alumni to help startups which were being incubated at IIM Bangalore. And so I've been amazed by the numerous startups which come here with good technology patents. And why I say that is, if I look at my experience in the healthcare domain, which is close to a decade and a half, most of it with Johnson and Johnson, and also with a startup which was part of a larger organization, HCL Technologies, HCL Healthcare. What I find is that success requires one to focus on problems identified very well. Okay, just to you mentioned about my exposure in J&J. I was part of a team, a very large team, uh, which was into blood glucose monitoring devices. And typically, like most multinationals, we would introduce products, which were for the US market or the international market and bring them to India. And they would only get as much traction, not so much traction. So we actually went back to our customers who were not only patients but also physicians and asked them as to India is supposed to be the diabetes capital of the world, and why is it that doctors and patients are reluctant to get into monitoring? So they told us that your product has too many features. What we need is something which is closer to what we do in practice, and what doctors in India asked patients to do was write down readings in a notebook. So what we did is, I think, thanks to the team at Johnson and Johnson, both in India, in the Asia Pacific region, and international J&J, the parent, LifeScan, the parent company, we were focused on doing something, and we heard the customer. And literally, I think one of the few cases where we made a product for this part of the world. The product, was tested in India based on feedback from some key opinion leaders in India, and the market just blew up. It actually triggered a lot of competitive activity, which also grew the market. So the key is to understand who you're serving. In case of healthcare, it is always the patient or people. In India and in the world, there's a lot of undiagnosed disease. So till you get not a very good label of a patient, you are a person. And so the key is to focus on what the person or patient, the central P does. And there is a pentagon of P's around this, comprising of the provider, which is basically another term for hospitals, the physicians who actually treat you, the payers, the insurance companies. In India, though, the insurance penetration is just about 30%, but still that segment is growing. Then the pharmacy, or you may want to call it the pipeline, another P. And then the policy. just we have just seen that in COVID, when people, because of a health scare, could not work, how the economy got hit. You know, and the health of the people is a key part of. If there are no people, no infrastructure will work actually. So it is about. So these are the 6 stakeholders in healthcare. The patient, the provider, the payer, okay, the policy maker, and the pharmacy. And all of these are working to serve the patient, and it is always about improving outcomes. Improving outcomes, and given the constraints in the country. If you go back to the lifespan example of J&J, which I gave you, see that product had one memory, just one last memory, last result. When contemporary products in the US of J&J itself had 250 memory and 14-day average, 7-day average, but this product, it did so well that this platform was transferred to another platform in the US. Similar looking, product was launched there in multicolors now. There had to be something different to excite people there. And then actually took J&J to market leadership there. So it is all about these 5 people, these 5 entities, the 5 stakeholders who are working with the constraints in India of access, affordability. You see, affordability was the key constraint here. Access, affordability, awareness, and adoption. So if you can create solutions for the patient or any of the other stakeholders, given these constraints, and given the fact that people, I talked about people and patients, so there is actually, everyone sees a continuum of care, right from wellness. I was looking for a term which was describe people who are not really tuned to wellness, as in going to gyms or walking in the morning, or not that active, but yet they are not patients, right? So the best term which came to my mind was another P only, people. Okay, so people, so there is wellness or there is nothing. Okay, wellness to sickness to cure. This is the continuum, healthcare continuum. And at every juncture, I think technology is going to completely revamp healthcare.
So there's another P that I can think of, Rahul, it's called prevention. Right? So
yeah, so that comes to, that's right. So that comes into that wellness people space. So today you can prevent disease. You can have medical devices which pick up signals and AI algorithms which actually prompt you, in different directions. Encourage you, just like the Nike app, which every one of us is using.
Yes, so predict and prevent. That's what you said.
Yeah, predict, prevent, minimize downtime, which in the medical world they will call average length of stay. Improve what they call quality of life adjusted years, quality. So it is about that. It's making people more productive, And if you look at if you look at startups, which you read about in the paper, the early investments, you will hear about 1mg, NetMeds. This is what pharmacy coming online. I don't know how well they serve the rural India, the 70% India. But in cities, maybe I don't know how much that is required. And post-COVID, almost every provider has got online consulting.
Yeah, agree.
So healthcare is amazing because you see, you talked about preventing, and everywhere in the world there is a shortage of doctors. Some countries may be better off. We are worse off, but we are trying to get there. our Prime Minister has a dream of having a hospital in every district in India. So it is very good. It is also about increasing the throughput of existing infrastructure, So technology coming in for quick diagnosis. It will make your current doctors, current radiologists more productive. So that is, so the space is very exciting. And ever since, and it is so exciting that the moment we created the joint mentoring program, I was amazed that some startups I could tweak towards healthcare, and with good results, they immediately got funding. And there are some very exciting. There were some very good startups, and most of the startups which we come across, at FITT or at IIM Bangalore, it's a little different in the Goldman Sachs program. Because they've already been selected and they have some sizable turnover. And they are actually looking for direction. As against here, where survival is a struggle, which is okay. It is not surprising, and people are very innovative. They'll find ways. They do find ways.
Yeah, that's a good point, actually. Yeah, so essentially, the motivation level of the founder and their understanding of the problem. What I have seen, Rahul, is in some of the startup that you worked with, wherever the startup founder was motivated, they had a good understanding of the problem. I think you really like them and you kind of help them along, and the honesty of the founder, the integrity of the founder, and that also plays a major role in your selection and your readiness to help those guys.
True, very true. Very true. And you see, and I will not blame, there's not a question of blaming anyone, but see, these are young people in their second year, third year, some idea catches their fancy. It can come from so many places. All of us, in a corporate journey, do realize that after some point, things like networking, collaborating, these are big skills. And many of us learn on the way. And these young kids, they have to know that quite early. It's a little tall order. It's a very tall order. But I think their experience with their startups, each of them, is going to be tremendous. I mean, if they can really navigate it to success, they'll be very happy. And that's what a sense of creation you have.
So when you look for, when you meet startup founders, what do you look for? And what really motivates you to select them? Yeah, this is the kind of startup that I want to mentor. Because what I've seen is you have a keen sense of selection. You are very particular about the kind of startup you want to work with. And I have invariably seen your judgment is correct. You are able to see almost ahead of everyone else that this guy is going to work out, this is not going to work out.
So, see, first is how compelling is the problem which he has chosen to solve. Okay, there could be many problems out there. How compelling is the problem which he has chosen to solve? What is the value proposition? What is the technology which is bringing to the table? Is there any? So, if you look at my favorite strategy map, you would have heard about it. So it basically says that how are you going to serve your customer better than others? So what is the uniqueness you bring to the table? How compelling is the problem and your solution? What's your revenue model? Many times I have come across people, they don't think through the revenue model. And then how good is your team? And then your attitude, things like values, ethics, I think you talked about right in the beginning. Very, very important. Your willingness to collaborate. Yeah, I think these are few things. And I'll tell you another thing I had been thinking, before this discussion. I think while one the board behind you says Angels Network, one has to look at unit economics very carefully. You should be so good that people should come to want to fund you. You know, in opposition to you just get funding and then everything. We have seen that can also go wrong.
That's true.
And
To be
maybe
specific,
for good reason.
yeah,
God knows.
no, absolutely agree. So the viability of the model, absolutely, what kind of problem have you identified, and how committed you are, how eager you are. And obviously, all these things are fundamental to the success of the startup. And another thing I remember you mentioning is the domain knowledge. I think you talked about that a few times. That how hands-on the founder is, how deeply do they understand the domain.
It comes from the problem he's chosen to solve. And has he? So sometimes we may have a hunch, that maybe this is what is going to work, but it needs to be tested with real people there. As what you refer to as, you've got to be able to develop a minimum viable product, and then take it on from there.
Yeah, no, fair point. So now I think your articulation of 5 Ps, and then we added another one, prevention or predict and prevent kind of thing, right? And we had these long conversations around what should be the vision for healthcare transformation in India, how we can make the healthcare more affordable, accessible, right, and ensure adoption at the same time, given those challenges in our country. So where do you see opportunities today? Because you talk about opportunity in the devices space, home care space, telemedicine space, diagnostics. So there are so many areas. Where do you see the opportunity?
So I think, Rajbir, there is an opportunity with each one of the stakeholders, each one of the P. Going to solve problems of access, affordability. If you take healthcare, early diagnosis, almost always results in better outcome. At times, prevention. So whether you can make diagnostic devices, which deliver this. Just about, I think, day before yesterday's Times of India carries a story about a partnership between Triple IT Delhi and GB Pant Hospital. Very interesting thing. So typically people who've had a heart attack, 10% is the mortality of people who've had an angioplasty, within the first 30 days, or there's some such statistic. Now, this statistic with which our doctors work is based on models, Western models, where access may not be an issue. So there are some 31 parameters, including maybe time to angioplasty, how easy it will come as part of access. Okay, so Triple IT Delhi and GB Pant Hospital, they have actually partnered to create an AI engine which can help them categorize the risk of people who had a heart attack and undergone treatment, because they can modulate some of these parameters and ensure lower mortality.
Thanks a lot, Rahul. And I really like the background that you have there. And it's all color coordinated, right? And even your headphone, which you didn't finally use, that also was part of the same color family. So
I struggle to find a good corner, for these Zoom meetings there.
Yeah, I can imagine that. When everyone is working from home, you have to find your quiet corner.
Oh yes. Yeah. Many parts of the house are no-go zones.
Thanks, Ram. Thank you so much. Once
Right,
again,
nice meeting you, Rajbir. Nice talking to you.
Yeah, thanks again for all your help over the last 4.5 years, and continuing to support the initiative. I appreciate that.
Pleasure.
Take care. Thank you. Bye.
Hi, I'm Rajbir. Welcome to Conversations with Mentors. We are mentors from IIT Delhi and I'm Bangalore. I4 Mentors Foundation. We are a not for profit. We are starting a cohort soon, and these are conversations with cohort leaders.